Hi, everyone. This is Dr. Jay Isaac from Blackburn Primary Care. So, I've gotten a lot of texts and calls asking if I could talk briefly about hydroxychloroquine. I learned today about a horrific incident where 70 veterans died at the Holyoke Soldiers Home of COVID-19. And people are wondering, isn't there anything you could give people prophylactically, or people who are susceptible and at risk in these kind of close quarter environments like hydroxychloroquine? And the answer, unfortunately, is no. Hydroxychloroquine is a drug that belongs to a family made back in the 1950s for a family of drugs, I should say, for malaria. And we currently use hydroxychloroquine for autoimmune conditions like lupus and Sjogren's disease. But there really is no other indication for it, although it's been hyped a lot. It is a drug that has safety concerns for the general population, I should say. So, for example, it can cause ventricular arrhythmias that can be fatal. And it's well known that it can cause QT prolongation, a cardiac condition. So, unfortunately, what you're hearing is a lot of rhetoric about studies and how useful something is. And what I guess the media doesn't tell you is there's all kinds of studies. There are meaningful studies and there are completely useless studies. And so somebody can slap the word study on, a presentation and make it sound like it's something imposing when it's absolutely not. So what do these terminologies mean? In vitro, in vivo? Well, in vitro is basically in the lab. Okay, you're doing it in a culture, in a test tube. It's not in real people. In vivo would be tests that you do in people or animals, etc. It is notorious that studies of in vitro medium does not translate to success in vivo studies. So when you see that somebody did some study on something on cell culture, that's nice. Maybe in many years that might pan out to something in real life for real people. Disregard. It should be studies done on people, not even monkeys and pigs and things like that, because even that takes a while before it becomes a real study in real people. And then you have all of these different types of studies on efficacy and on safety and all this kind of stuff. So they all have a period of time that has to go by before you know if a certain drug is effective and safe. There have been many drugs over the years that have come out with all of these studies, and in the real world of millions upon millions of people have been found to be unsafe and recalled. Okay, so we shouldn't get excited. A good study has to be powered well. It has to have a lot of people in it. If you have a study with a dozen people in it, in my book, it's useless. It's got to have several thousand people in it to even begin to be something useful. There's prospective versus retrospective. So prospective is something where you set up the study to really see if this medication is different from, say, placebo or some other pre-existing medication out there. Retrospective is basically you look back on other studies. It's looking back to see if studies show anything, and sometimes you get these meta-analyses where you look at multiple different studies, but studies are constructed differently. You can't. Sometimes it's comparing apples to oranges. So I'm sorry to get into all of this stuff. I know it's boring, but a lot of this stuff is hype. There really isn't any good information about something useful out there to help us with this COVID condition. things like hydroxychloroquine may be useful in some patients in an inpatient setting, but in an outpatient setting, it isn't. So don't try to get your hands on it. Don't stockpile it. And if there's a shortage, the people it'll affect are the people who are currently being treated for serious conditions like Sjogren's disease. So let's just give up the hype on this hydroxychloroquine stuff and focus on monitoring people for who has it, who doesn't, who's recovered. Testing is really what is required. I hope that helps. Be safe, be well, take care.